Okay, so this is the template for evaluation. We have the symptom up here, which is the effect, cause. An evaluation is basically connecting the symptom with the correct real cause. To do that, you have to evaluate, which means to look closely at all the information. This is data, all the information. That's why you're asking questions. You're narrowing down your investigation. So you have to really study the subject if you're doing, like, for example, if you're let's say the adrenals, okay, the adrenal body type. You have to know about the adrenal to be able to evaluate, because you have to know about blood sugars to be able to evaluate. You have to know about an engine before you can evaluate. So this is an essential, like, a thing you need to know first. But there's many, many different causes of a symptom, and you're just going to narrow down by asking questions and see what aligns with a potential cause. So, like I said, if you have fatigue, I mean, that could, and you start asking, like, this is the most important question, time. When did it start? When did you first notice you got a fever? When did you start noticing you started gaining weight? When did you start noticing you had a sleeping problem or fatigue? Then it's going to be after a big clue, and then now that's going to start to narrow down your thought process so we can rule stuff out. Because let's say they have pain in the right lower abdomen area, and then when did it start? 3 days ago, and you thinking, well, it's probably ovary, and you're talking on the phone, but then you find out, when you ask a lot of questions about the data, you find out this lady is 83 years old. So what does that tell you? It tells you that it's not going to be the ovary. So what happened? When did it start happening, and what happened just before? What change occurred with diet, stress? What did you do? She says, I stopped drinking the cranberry juice. Okay? Or no, I'm sorry. She started drinking a cranberry juice when this pain started. Okay? In the lower quadrant. And then you go, oh, okay, well, what could... Now, you know that what cranberry affects the kidneys. Cranberry dissolves kidney stones. So she probably dissolved... The most obvious thing is she dissolved crud from your kidney, and it went down the tube between your kidney and your bladder and caused that discomfort. So that would be the most likely thing based on your knowing the information. So you're looking at the information, you're asking questions about it, you're seeing how things relate, and you say, like, well, I don't understand that. You keep asking questions until you get to the real cause. Okay, that's the simplicity of evaluation. But again, we have to link cause and effect. They're two different things, and when you get the right cause, you get a lot of cooperation from the patient. It makes sense to them. They just intuitively, they go, yeah, okay, that makes sense. Depression. Let's take depression for example. So one of the things that I want to add here is defining the problem. Okay? What do you mean by depression? Tell me what it feels like. Oh, it's a heaviness. It's a fatigue, heaviness. Like, oh, okay. Because what does depression feel like? What does anxiety feel? Say anxiety, I'd say, what does it, describe it to me? Oh, it's like a heaviness. Where? In my chest. Ah. Or it's I'm depressed. I have fatigue in my eyes. I'm like, oh, well, I already know that tired eyes occur if you skip protein for breakfast. That's just a fact that I know. And so some of the questions I'm going to find out, what do you eat for breakfast? And they're going to say, I eat an English muffin. Boom. Now we deal with, now it's a blood sugar thing. You see how I evaluated that? I'm associating data with a root cause because I understand the subject quite well. But if they say I have a heaviness on my head, and you don't get anywhere, you say, well, have you ever injured your head? And they go, yes, I was in the hospital for 2 months with a head concussion. I'm like, oh my God, boom, that's it right there. So it's an old injury. No wonder your head, and you thought you were depressed? Or you might find they're depressed is really, it's really a tiredness in their whole body. And then you find out that they don't sleep at all. And then you find out why, keep asking questions, and you can find the real cause. But again, that's how you evaluate. So you need to get good at evaluation.